to you by Emory University.
A lot of our residents have lost hope.
But on this day, Reverend Larry Hill, along with members of Emory's Urban Health Initiative, are helping to raise hope for residents of Rolling Bends, located in northwest Atlanta.
We're known as a food desert community, and in order to get to a grocery store or to the doctor or to the laundromat, most of the time the residents do not have transportation.
The Urban Health Initiative brings together Emory experts with civic and community organizations and businesses to find practical solutions to persistent health threats in underserved communities like this one.
I went out and tried to find a healthy meal at the local stores and convenience stores and package stores in this neighborhood. And I found that the green things I could get would be when I went in the package store, lemons and limes. I found olives, and I found 5 kinds of juices if you consider Bloody Mary mix a juice.
This pilot test of the Urban Health Initiative's transportation ministry was sponsored by grants from the Emory Office of Sustainability and the Center for Community Partnerships. Transportation was provided by Word of God Ministries.
Does it have a word of prayer?
Many people here don't own their own vehicle, and public transportation is frequently unreliable. The seemingly routine task of grocery shopping for fresh meats, dairy, and produce is often out of reach.
It be hard because you have to walk around, find somebody to pay, and if you don't have the money, you have to walk to the store. You have no other choice.
People pay the ride man, who is the local neighbor who will give them a ride and wait or come back and pick them up. And what we found is sometimes they charge as much as $20 to $28 round trip just for the ride.
Messing with the ride man, it is very hard.
What we're trying to do is get people access to healthy foods. Part of what we're doing as a whole transportation initiative is to provide classes that will show people how to look at labels, that there are other options. And what you're going to do is look at the fat content. Nutrition relates to everything we do, everything that we are. It's an old saying, you are what you eat, and it's really true. Okay, that's good. Now let's look at that.
As this outing demonstrates, shedding unhealthy habits doesn't happen overnight.
And like this in particular, this is all processed. This will be a part of a bigger initiative, a food oasis campaign in this whole Northwest Atlanta, Upper Southwest Atlanta area, where we're going to engage several organizations to come together to provide healthier options.
Options that can have an empowering impact on those bold enough to take advantage of them.
I have to eat bananas because my potassium is too low.
And it's just a matter of re-educating ourselves to know that by making some simple choices, you can improve your health. And many times, once you start doing it, you'll really appreciate the knowledge that you've gained and how ultimately your health is improved.
The preceding program is copyrighted by Emory University.